Hi, this is Nick Farr with Insight Creative Arts Therapy to explore vocal effects and settings you can use in your telehealth music therapy sessions to increase the quality and range of music experiences for your clients. I will be using a digital audio workstation to manage my effects. If you want to know more about DAWs and how to route them into Zoom, please check out my other videos. I use Ableton Live 9 to manage my audio for my telehealth sessions. Nearly every DAW has effect channels to add and modify effects to your vocal chain. If you need help, there are plenty of videos explaining how to set up your effects on the DAW of your choice. The first effect I use in my chain is a gate or noise gate. A gate only allows the audio signal to be heard if they are higher or louder than the threshold you set. I use this to cut out the hum of my air conditioner and other small pesky noises that can occur when working through video, especially from your home. To set the gate, look at the signal with the static noise of the room and place it just above that level. This way, your room noise will be cut out if you are listening to your client. You do not want to set it too high or your music and voice will also be cut out by the gate. The attack, hold, and release set the speed in which the sound will push through the threshold, continue to be heard, and then cut out. Test and modify this with the sustain of any acoustic instruments you may be using. I always place the gate first in the effects chain. Side note, all video communication services use versions of noise gates to reduce background noise. This is why live music cuts in and out. To learn how to disable this on Zoom, please see my other video. The next effect in my chain is a compressor. Simply, a compressor reduces the dynamic range of the audio signal. It makes the quieter parts louder and the louder parts a little quieter. This can help bring out the subtleties of acoustic instruments and keep your signal from peaking on your client's device. I typically use a 4:1 ratio with a 0.5 millisecond attack and a 240 millisecond release, but feel free to experiment on what works for you and your instruments. Here is a before without the compressor on, and the after effect. Next, I use a multiband EQ. The EQ boosts and cuts frequency ranges to modify the qualities of your audio. I recommend exploring some videos from audio professionals to help you find the EQ settings to fit your voice, instruments, and room. Personally, I cut out most of the low ends, about 90 hertz, a small cut around 250, and a little boost at 5500. This is the EQ off of what my voice sounds like without, and the EQ on. Subtle differences, but makes a big difference in acoustic instruments. These three effects are left on nearly all the time and modified when needed to fit different clinical situations. The rest of the effects I will explore are only used in some musical experiences when appropriate. I've set up a small room reverb effect. I like the standard setting on this one and only modify the dry-wet mix, which means how much of the reverb is affecting my audio. If you have a MIDI controller with a knob, I MIDI mapped the knob to this wheel so I can modify the mix with ease during my sessions. Here's a range of the reverb, really low, going up around medium, 50%, higher, 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 and 100%, lots of reverb. Another fun focal effect is a type of EQ setting sometimes called a telephone effect. This cuts out all the low and high frequencies while boosting the mids. This effect can be great for clients creating hip-hop with the telephone effect. Another staple of hip-hop music is autotune. You can find a free VST called Auburn Sounds Graillon 2 and place it in your plugins. Although some of the features are paid only, the auto-tune is free and can be set to specific scales and frequencies. Let's turn it on. Auto-tuned. There are plenty of other vocal effects that can be experimented with to expand your musical resources for telehealth music therapy sessions. Which effects are you interested in? Please write your thoughts or questions you may have about telehealth music therapy in the comments, and don't forget to subscribe.